Welcome to the Fresh RN podcast. The information contained in this podcast is meant to supplement your existing knowledge and not replace it. Always refer to your state board of nursing, standards of care, and respective institutions' policies to guide your practice. All identifying patient details have been changed to protect their privacy and remain compliant with the Health Insurance Portability and Accountability Act of 1996. Thanks, nurses. Stay fresh. Thank you guys for joining us today for the podcast. Welcome. I am Katie Kleber.
And I'm Melissa Stafford.
And we have a wonderful guest here today, Karen Keston. Okay, guys, I'm going to list her credentials here. DNP, RN, APRN, CCRNK, CCNS, and CNE. She is the chair of the AACN, which is the American Association of Critical Care Nurses Certification Corporation Board of Directors. She worked with cardiac ICU patients and in cardiac recovery for over 20 years in various facilities. She is an associate professor at the George Washington University School of Nursing in DC. She has experience as a bedside critical care nurse, educator, and researcher. She most recently served as the director of faculty initiatives at the American Association of Colleges of Nurses in DC as well. She provided leadership as an associate professor and director of the acute care nurse practitioner and clinical nurse specialist programs at Georgetown University School of Nursing and Health Studies from 1999 to 2016. Welcome, Karen.
Thank you so much for having me.
So what I want to ask you to do that we don't ask everybody to do is please explain to these new nurses your credentials. So DNP is?
Doctor of Nursing Practice.
RN, we all know what your RN is, registered nurse.
Right.
APRN.
So that's a licensure that's given throughout the states for advanced practice registered nurse.
And then CCRNK.
So that's acute and critical care certified nurse, and the K stands for knowledge, meaning that you're indirectly influencing practice at the bedside, but no longer necessarily currently practicing at the bedside.
And that's relatively new, right?
Yes, it is new, right.
And then the next one was CCNS.
That's an acute and critical care certified clinical nurse specialist.
And then the last one was CNE.
Certified nurse educator.
So this episode is about certifications. And me and Melissa and actually Elizabeth and I, we all have mentioned that we are certified nurses before. And I'm certified in critical care, as is Melissa. She also has her stroke certification. And we wanted to talk about why that matters, why you should want to do that, and who better to chat about this
than the expert.
truly the expert. So Melissa, do you want to kind of start out?
Sure. So, one of the things I noticed when I first came to NCI is everyone had all these credentials, and there's a lot of letters in the alphabet.
We call it alphabet soup.
Yes, it really is.
And it can be overwhelming, but at the same time, it's a good goal to work for. So, can you tell us kind of step one? I graduated from nursing school. What is a certified nurse?
Absolutely. One of the things that's beautiful about nursing is that there's so many different specialty areas that we can go into. And certification provides a nurse an opportunity to meet national standards in a specialty area. So maybe you're really excited about women's health or about obstetrics or about psych mental health or critical care or med-surg and their neuro, renal. There's all kinds of national nursing organizations out there that provide the opportunity for nurses to receive resources to deliver the best care that they possibly can to that specialty population. And they also many times offer certification exams so that the nurse can really demonstrate excellence in meeting those national standards.
So that is really the definition of what a certified nurse is. Now, naturally, it's not something that you graduating nursing school can start doing day one. Right. You have to get one of the big aspects of certified nurse is you have clinical experience, expertise, knowledge that takes time to develop. So we're going to utilize the American Association of Critical Care Nurses kind of as a template. A lot of them are similar. in different specialties, but not identical. We want to give that little caveat there. So let's say we've got a brand new ICU nurse listening, and we've told them about certified nursing, and they want to be a certified nurse. How do they do that?
So first they have to identify an area that they feel passionate about, that they have experience in. So it takes a couple of years of working full-time at the bedside in a specialty area to really identify this is, my love, my passion. This is an area where I'd like to let patients and families know, let my employer know that, I have met excellent standards. And so once you settle into an area that you really feel comfortable with and you gain that experience, a couple of years full-time at the bedside, then you know that you're ready to look into what might be possible for you to get certified. And maybe there's more than one.
Yeah, that's true. You can't, Melissa's certified, and you got both, obviously, have more than one certification. You don't, there's not okay, you have one thing you can do. A lot of, in neuro ICU, you can sit for the critical care, the stroke one. There's a neuroscience one. When I was started out, I was in a cardiac step down. So we technically could have taken the med-surg one, because we had a large amount of med-surg patients, but then we also qualified to sit for the, I think it's called the PCCN.
Right, yes. The American Association of Critical Care Nurses offers the Progressive Care Certified Nurse exam, and that is especially important for the high level of acuity that we have in patients in acute care settings. Patients especially who are on telemetry monitoring with a cardiac, a pulmonary, area that they're hospitalized for. Or diagnosis, and progressive care can even extend out into the community, into long-term care facilities.
Really?
And it's branching out and growing rapidly. We have a lot of nurses that are learning more about progressive care certification, because as you see, the acutely ill patients are moving out of the hospital and into the community. So it doesn't really matter where they live. It's more about the kind of care that they need and what kind of a nurse would be the best fit to deliver that care.
That makes sense.
So you have, and again, like she said, this is not something that you come out of school and you take another test 6 months later. This is something that you spend time getting to know your patient population. And, when you first start out on a floor, you may decide that that's not your love. You want to go try something new, and that's okay. But this is something that you develop your skills in over a period of time, of generally 2 years. I think it goes 3 years for some. I don't know. But checking in with that governing body will let you know what kind of experience that you need. And it's a goal. It's a long-term goal that you have to recognize yourself.
It is a long-term goal.
Yeah. It's not something you can do right out of the gate, even though I know there's a lot of go-getters listening to this right now that are like, hey, my goal is to be a CCRN nurse. And that's wonderful. So it's good to have this on your radar, because those of you that are getting out of school right now, just getting started, you're not going to be eligible to sit yet. There are some minimum requirements of amount of time to work, and those differ based from accrediting body. So for the American Association of Critical Care Nurses with the CCRN, roughly 2 years full time. There's an hour requirement, and then once you meet that, then you can start looking at taking the certification exam. So can you talk about the certification exam a little bit? We've all obviously taken it.
Sure.
And that was challenging.
It is. It definitely is, and it's a real feather in your cap when you take that and you pass it.
I love how you said that.
You really, you really have to be proud of that. When I got out of school, for some reason, the American Association of Critical Care Nurses became my go-to organization for resources that I needed to learn as a new graduate nurse in an ICU. First, right out of the gate, that's where I landed in my first deployment. And so AACN provided me lots of resources, and that's how I learned about certification. But I didn't take my exam actually for 5 years. I worked five years before I took it. And the thing that spurred me on was actually a group of nurses on my unit formed a study group and a support study group for each other. So, we bought the core curriculum, which was the resource at that time that was really effective in helping us study for it. And AACN has oodles of resources. If you go on their website at aacn.org, you can find practice tests, you can find test blueprints, you can find all kinds of resources to help prepare you, textbooks as well, lots of practice questions. And the test blueprint is really nice because it actually divides up the test and lets you know exactly what percentage of your time should you spend studying cardiac, how much time should you look into neuro and renal, and what about the synergy model? That's a big piece for AACN.
That got me. I did not realize how big of a piece of the exam, because I didn't look at the blueprint like I should have. And I understudied that. I still passed, but I definitely didn't do near as well in that aspect as I really had thought I would.
It does help to read a bit about it to begin to understand it, and the handbook that they have for certification, if you download that or look at that, it describes the synergy model and it shows you example questions and gives you the rationale for what the right answers are. So you begin to get an idea, oh yeah, this is why, they put this question in there. It could have been a trauma patient, a cardiac patient, a renal patient, but the question wasn't really about that, it was about an ethical dilemma that you might face that could be common to all of those.
And I think that's important to point out too, like you had mentioned that AACN has a multitude of resources out there available for nurses of all levels of expertise. And just because you're not eligible to sit for the certification exam yet, coming out of school and becoming a member of AACN or some other sort of credentialing body will give you wonderful resources to go to and really well-established and reliable resources to go to, as opposed to some of the other things out there that may or may not necessarily be reliable. But it was amazing to me. I'm actually kind of embarrassed to say that although I took a neuroscience certification fairly early on in my neuro ICU career, it took me, I'm going to think, 13 years before I took the critical care one. And I don't really have an aha moment of why I finally decided to do it, but all I know is I remember studying for it and stressing out about it and sitting for it. And the moment that it came up and said I passed, I was like, time to celebrate.
Yes!
That's right.
Like I have this.
And
it's such a, what's the word I'm looking for? It's such a personal validation tool in a way. Like, it really made me feel like, okay, I do have, a good grasp of critical care, a general critical care, not just neuro, and although in some ways it was a little humbling, like the fact that I need to brush up on a little more of my cardiac skills, but, in other ways it was a very good tool for me to say, what, I did it, and I have this, and I felt like a better nurse in a way. I mean, it didn't change me as a nurse. I still take care of the patients, but it was a very good pick-me-up that I needed at that time.
It's a really great confidence builder, because it's not an easy test.
it is not.
But I think of it as a journey. Whether you sit for it this year or next year, or it's a 2-year, 3-year goal, it's more about the journey. And as you're preparing, maybe you attend a prep course, which is a great way, to a 1 or 2 day prep course that they may have available in your region or through your chapter, or whether you can tap on something online that's available. It's all about the journey, really, of improving your knowledge base and demonstrating that you have the knowledge, the skills, to do the job, to provide excellent care. And even patients will say, what does that mean on your badge there that says CCRN? What is that? And then you tell them, and then they're like, oh, I want to request one of those for my next shift.
I love it. So one of the things that I think, you think the new grad who just got done taking the NCLEX, and I think and I know I did this, connected the setup of the certification exams like the NCLEX, the computer adaptive, you take this question, then you get a harder one, you get this, and it shuts off at 75. And can you explain the differences between NCLEX and certification exam from that kind of technical standpoint, I guess? Because they are different. They're not, I felt like, from someone who's taken them, I feel like the certification was extremely challenging, but it wasn't it was very different than the NCLEX, just structure-wise, at least that's what it felt like.
One of the things that happened to me when I stepped away from taking that exam was that I realized that my experience actually helped me answer those questions more than anything else. You know, like I thought about it and tried to explain to a friend, you know, what was on it and how to prepare. I kept going back, you know, it's more about common sense and experience, really, helping me get through it. So I think that practice experience is so important. But it is available, you know, online as a computerized exam. You can go and sit for it. You can schedule an appointment to sit for. Many H&R Blocks around the country have a testing center, and it's kind of weird to go into an H&R Block and take an exam on a computer in a room that's quiet, and you have to leave, you know, lock up your belongings in a locker outside, and there's a camera that's looking at you, you know, like, and you see your little face there, and you want to hide it, right? So you bring a little sticky in with you and just hide it, so you're not staring at yourself. But it doesn't shut off after 75 questions. It's not that kind of test. It doesn't prompt you to have harder questions, or if you get something wrong in a category, to drill down on that. It's not like that. So it's, and it's a lot about the synergy model too. I think, you know, if you can read the question and read the stem of the question, what is it this question is really asking? And cover up the answers and think, you know, well, what's the answer to that question? Think about the answer first in your mind, and then uncover the questions and then say, oh, that one really matches what I was thinking. Then you're kind of heading down the right path.
Yeah.
And you have an advantage too, because you know you graduate from nursing school for the NCLEX, and you just got bombarded with either 2 or 4 years of training but no real experience rather than clinical experience. You know, you have very limited and very, and some programs are structured a little differently. So you may have a little more clinical time at one school than another school does. But when you take a certification exam, you really have that opportunity to already kind of develop those skills and start putting together the pieces. You got little pieces during school, little pieces that they concentrated on for the NCLEX. But for when you sit for a certification exam, now you're thinking about practical application of the knowledge that you have, and really trying to put that together and take care of the patient.
And a lot of times you, as a new grad in ICU, or if you're hired from med-surg to ICU, in this particular example, you have an orientation. And sometimes they provide you, your employer provides you with some coursework, you know, and much of that is preparatory for sitting for the CCR exam. You know, it helps prepare you to be better skilled at the bedside. And then your experience confirms that, affirms that, and it makes you feel more confident to take the exam.
So I want to talk and have each of us like go through our prep, how we prepared, because I know we did different things. I took my CCRN after I think three years, I think, at the bedside. So our hospital, you know, we had recently gotten Magnet maybe, and really pushing to have certified nurses. So our educators had purchased something from this AACN where it was like, I only had to pay $30, but I got this awesome review course. So I did that, and it was like over a few days, and you know, it was actually online. So I watched it, you know, and took the notes from that, and then I purchased the past CCRN book, and I didn't actually look at the book much. I used the question bank.
And those are harder questions than the CCRN exam.
Oh my gosh! So I didn't realize that.
Yes.
And I'm like I'm getting stuff wrong, and you know, I felt like I was studying for the NCLEX all over again. And then because that is like you get such a lower percentage than you're used to from nursing school, right? And I looked it up online, and it was like I found out later, or pretty close to before the exam. So I felt a little bit better. Like, okay, if you're getting like 60,
if you're getting 70%, you're definitely going to ace the CCRN exam.
Yes, exactly. So that was kind of mine, and I can't remember how long I studied, 3 or 4 months, like really, really buckled down and studied, not you know, casually here and there. And then I took it, and what's funny is I took a pre-test on like with the past CCR and stuff, right? And it tells you what to focus on. And of course I did the best in neuro because I'm in the neuro ICU. I did the worst, I think, in respiratory and multi-system. And cardiac. So I studied really hard in those. And then I took it, and actually when you take the CCRN, you get a printout of what you pass or fail, but then it also tells you percentage-wise of what you got right in each category. and I aced the respiratory and the cardiac. and multi-system,
You studied for this.
But then I did terrible on the neuro. I was so mad. but I ended up passing, and that was, I think, 2015, because I was due for my thing in 2018. So that's kind of what I did to study. What about you, Melissa?
I did not take a review course. I did a lot. I'm a weird study person, honestly. I like practice questions, and I like going through lots of practice questions and just doing it that way. And I write a lot, so it isn't. I remember things when I write them, so I wouldn't just write it. I would literally write the question and then write the answer, and then kind of talk about the rationale behind it. So I had a kind of a flip book that I had purchased at one of the NTIs for CCRN review. I used the app that AACN has out for your iPhone, iPad, whatever, with practice CCRN exam questions a lot. I did have a video that one of our educators had provided, and I can't remember where it originally came from. But what I found was, actually, I took the exam right after they changed kind of the question makeup. So for cardiac, for example, I studied a lot of EKG and how to read EKG and, rhythm changes and medications and whatnot. And what I found in reality when I was studying for the test is there was actually a lot of balloon pump questions on there. And I'm like, oh.
Which are so scary to me.
I am a neuro nurse. I know what a balloon pump does overall, but I'm like, oh, I didn't study for this, right? So, but that was on me, and I have to take ownership of that because I didn't look at the resources available really well and really get kind of the drill down and really understand how the test changed. Because it changes, every 4 years?
Every 5 years, right. We do a study of practice, and we try to validate whether or not nurses are actually using that knowledge. We use that to guide our test blueprint. The actual study of practice where nurses indicate how much time they spend in each category. We have an expert review committee that also comes in and says, no, they're not using that technology anymore. That's not relevant.
Yeah, because that stuff changes. So, we were just talking to Mike Ackerman and Tom
Ahrens,
and about technology and how, so CVP isn't for fluid resuscitation. You shouldn't be looking at that. You can look at that with cardiac stuff, but not when you're looking at evaluating how effective your fluid. So it's like that stuff frequently changes. So it's important that it's being reevaluated on a regular basis. So I think it's important for all specialties, but critical care with such specific technologies and stuff, it's just so important that stuff.
It has to be current, right? We have to stay current, absolutely. I actually took the test twice.
Really?
Yeah, so because I've been in nursing longer than you all had, I worked for 5 years, and then I took the CCRN exam, and I passed. And then I continued working for a number of years beyond that, but then by the time my family grew, I wasn't able to keep up I stayed part-time working, but I didn't have quite enough hours to sit for the CCRN, or to renew my CCRN. So I let it lapse for a while. And then when I was ready to get back, the kids were in school, and I wasn't at home as much and could up my practice hours, and I regained them. I sat for the CCRN exam again, right? Like, you don't want to do that. You want to avoid that at all costs.
Do that.
So let's talk about that, though. Okay, because one of the things we wanted to make sure we talked about was, I got certified, I passed the exam. How do I maintain it? Like, what is
right?
Because I think it's relatively similar with a lot of different certifications. How do I maintain this?
So there are a minimum number of practice hours that you have to have over a 5-year period in order to maintain your certifications. So the renewal's every 5 years. And if you're unable to have that number of practice hours, then you have to let it lapse. So I would say you want to make sure that you're, keeping your finger in, the pot, and you're keeping consciously aware of how many practice hours you have, no matter what else has gone on in your life, if you want to renew it. And then renewal can also be done in addition, looking at CEUs. We call them CERPs and AACN, but continuing education units demonstrating that you're staying current in the field, that your knowledge base is current. is part of the renewal process as well as maintaining that practice.
And it's a pretty
Requirement.
hefty amount to maintain, correct? Of a number of.
I don't know it off
CEUs.
the top of my head. I'm not sure how many it is, but many states are requiring CEUs for renewal of your license anyway. So if you're attending continuing education, you just want to start a file and, keep your records clean and up to date, and then you have it right there available for you. And with the renewal with AACN, you go online and you check that you have those CEUs and you have them validated at home, but unless you get audited, you don't really need to send all those in. So they're available in the event of an audit.
Yes, but make sure you keep them because people do get audited.
Yes, I got audited.
Yes.
Yeah.
And I think that's important too. I mean, if you get a certification, that's great. But really, I mean, most states, like you said, require those continuing education credits. So it's good to get in the practice coming fresh out of school. When you take advantage of a learning opportunity that has CEUs attached to it, keep up with it.
Yes.
Because I did a horrid job of that. And
Keep
that's
the
how
paper trail.
And that's how I ended up letting my CNR lapse, was because I did a horrid job of keeping up with that.
Well, luckily
So-
today, a lot of the things are electronic, so you're
Yes.
able to download it and save it electronically in a folder, and you don't have to worry about
Yes, I
losing
actually
paper
logged on
copies.
to my profile for AACN, and it told me exactly how many hours I had in each category. So it's like, okay, I need to make sure this time at NTI that I take these kind of classes, so I get my hours in, and it keeps up with it really nice.
Right.
So.
Yeah, so like, no matter what, even if you're not certified, keeping up with your paperwork is just so important.
Oh my
Like,
goodness,
it's just
yes.
your professional responsibility as a nurse to get a file going that says, okay, here's when my license is due for renewal, here's where I'm keeping all my CEUs, and then if you're looking at becoming certified, you already have that kind of already set up. Yeah, I have my little folders that have my license, my professional organization paperwork, and then my CEUs, so I don't lose them. Because sometimes you go to events and they just give you a piece of paper, and it's up to you to keep that in the event that you get audited.
Right. And like just in the unit that I work in, we're required to have 8 hours of stroke education per year and 8 hours of trauma education per year. So it's my responsibility, not my employer's responsibility, to make sure that I'm taking advantage of whatever educational opportunities are out there.
Yeah.
Whether they be through AACN or, maybe perhaps through the American Stroke Association or AHA or, something like that. So it's from the get-go, coming out of school, keep up with your continuing education credits.
Yeah, be a good record keeper, because I like how that you said that, because I think, you go into nursing school and you think that whatever they need from me, they're just going to tell me. And there's things though, when you become a licensed nurse, it's your responsibility, not your employer, not your professional organization. It's your responsibility to keep this paperwork together, so that you can say, yes, I've been doing my CEUs, yes, I can get my license, and my knowledge is current. So it's really important that if you start off your career being diligent with that organization, it makes things
A whole lot easier.
I just want to say, to me, the best reason to get certified in whatever specialty area that you're excited about is that self-satisfaction that you have from achieving that goal, setting a goal for yourself, a long-term goal, and working towards it with others or alone, however you best study. But the nurses who become certified really have a lot of pride in that mark of distinction and mark of excellence that they've achieved. And many employers will recognize certified nurses in many different ways. We have, Certified Nurses Day, and we have employers who provide compensation or reimbursement for the sitting fee for the exam. Or maybe in some instances we see your hourly rate is increased, or you can move up in the clinical ladder with certification. Certainly, if you decide to go on to school, to graduate school, being a certified nurse gives you an edge up over other nurses who are applying. It shows that you have real self-direction, and show great initiative in your professionalism and improving your, being a lifelong learner. And so I think that's the best reason for getting certified, is how you feel about yourself.
Oh, I'll definitely attest to that. It felt really cool to add those letters at the end of my name. And I don't know if the people that are listening realize when you get your certification, you add letters, you add credentials, so you add things to the end of your name, and it feels really, really awesome to be able to do that. And yeah, it does. Like at my previous facility, for a while they were actually paying up front They wanted people to be certified so bad, it was like, hey, we'll give you whatever the cost was to sit for the exam ahead of time so that you can schedule it and you actually aren't, out of pocket. They recently had to change that, and then they'll reimburse. But then, yeah, there are hospitals that may increase your hourly rate, or help bump you up on the clinical ladder. So there's like a lot of employers really love it when their employees have certifications.
And especially if your hospital's on a magnet journey,
Oh, yes.
or you have a beacon unit in your hospital, they're looking for a higher percentage of certified nurses to indicate the increased professionalism among the staff.
Yes, and one of the things too is, if no one else on your unit is certified, that doesn't mean you can't do it.
Right.
I think too, one of the things is if one person does it, other people tend to follow because they realize it's a goal that it's not this like out there goal that I can't necessarily ever get. This is a real attainable thing that someone I know did, and I think that if one person does it, it can kind of get the ball rolling.
Right.
So encourage you guys, even if you don't have anyone on your unit that's certified, or maybe the only one that's certified is that crazy smart nurse that you're like, I'll never be her or him. Like, no, it's possible. It absolutely
More
is.
than likely, you say, well, if she could do it, so can I.
Exactly, yes. Yes, so we encourage you guys to check out the various resources, so the American Association of Critical Care Nurses, you go to their website, but if you're a dialysis nurse, OB, you check out your specific professional organization and the resources they have. And then also I wanted to make sure this is right, the ANCC, they have their own set of credentials or certifications that you can get through them as
That's the
well.
American Nurse Credentialing Center.
Yes.
Right, and they do certify a lot of advanced practice nurses in all different types of specialties. And so they do have a large number of different certifications, but I believe the RN certification, for med-surg RN is in that category also with the
Okay.
ANCC.
So ANCC, I believe it's ANCC.org, I think.
I'm not sure.
I'll put a link to it in our show notes so that you guys can take a look at that. And I'll put some different professional organizations and their little, information about how to get certified, like the med-surg and the PCCN.
The PCCN, Progressive Care
Yes.
Certified Nurse, if you're in a tele unit or a step-down unit, or if you're doing a lot of care of, patients that require monitoring frequently, a lot of higher level skills, that's a great certification to look into because it's broad.
Yeah. Yeah, I know I could have sat, with my first job, I could have sat for that one. I ended up moving and started in critical care, so that kind of changed things. But there's also the emergency department one. There's just tons. So I'll make sure to put some notes or some links in the show notes so that you guys can go look at those specifically. And I think that's about it. Did you have any more certification kinds of questions?
I don't think questions. I think, I just want to recap in that, when you graduate from school, just bear in mind you're not going to be eligible right away, but there's a multitude of resources out there through various, how did you word it? I say credentialing, and that's not right.
Professional
organizations that offer you resources to guide your practice for nursing. And then as you gain experience, looking at the excellence that comes along with getting your certification. I mean, I really can't say enough that I had been a nurse for, I forget how many years, and it still felt good to be able to put those letters behind my name. Because I did feel like it really validated. It was a good personal validation for me.
And I have to say that once you become certified, you also gain access to a whole community of nurses who are also certified. So they kind of take you into the fold, and you have a lot of peers and mentors. And then one day you find yourself paying it forward and being a mentor to others, and teaching in a certified, prep course, or encouraging someone else to go back, or studying with somebody. It's, it happens real fast. We always say, see one, do one, teach one, right?
Yes, exactly.
That's true.
All right. Well, thank you so much for joining us.
Well, thank you for having me. It was delightful to meet both of you.
Yes.
Well.
All right, nurses, take a look at all of the notes that are on the notes. I will have some links for some additional resources, and stay fresh.
Damn girl, better hit the floor. All the other fellas better run for the door. Stop, drop, and roll with me.